Hi, my name is Dr. Carl Truesdale, and I am a double board certified facial plastic surgeon, and I work in Beverly Hills, California. I perform facelifts, rhinoplasties, eyelid surgery, and much more. My job is one as an entrepreneur, a businessman, a husband, a father, but a surgeon who gets to transform patients' lives. Beyond the surface to me means the transformation and the journey that my patients go through. It's not about the external, it's not about the facade, it's not superficial. We are going to dive in to what makes my patients tick, a little bit about my life, and all the drama of owning and operating a practice in Beverly Hills, California. It's plastic surgery, but it's so much more. As a business owner, every day has its ups and downs. There's a lot of things that you have to work through. My business is growing. You're gonna see my business transform. We have a lot of things that are about to drop, some really exciting news that we're gonna announce. We're gonna be launching some courses. We're gonna be launching products. We're gonna be opening an office. You're gonna see it all behind the scenes, up close and personal. And I think by the end of the season, my personal goal is to have my practice continue to grow and thrive and to continue to make positive impact on my patients' lives. Hey there.
Hi.
Welcome.
How are you? Nice to meet you.
Fantastic. Nice to meet you in
too.
person.
My name is Danielle, and I'm here to get rhinoplasty with Dr. Truesdale. I'm a mom. I have a 5-year-old daughter. I just pretty much have a normal life. I go to work. I work from home, so I don't get out too much. So I came all the way from Chicago to California to have surgery. I'm really excited.
So you have an F1.
Yeah.
So these tumors started growing when you were
Like 5.
5.
Yeah.
Okay. And so what I'm going to do is I'm going to remove them
Right.
for you. And a big part of that is the nasal neurofibroma.
Mm-hmm.
And so you'll be able to breathe better.
Yeah.
It'll look better.
Mm-hmm.
Are you excited?
Yeah.
She has a condition named neurofibromatosis type 1. So this is a genetic condition in which tumors are formed throughout her body. These tumors, especially the one in her nose, has caused her a lot of issues over time. It's been growing since she was a child.
I don't know anybody else who has neurofibromatosis in real life. I do know people like I've met online who have it, but never anybody that I've came across in real life. I have good friends. I've always had a lot of good friends, close friends. So it was just more so people who didn't really know me that affected me. So I don't want to say it was so much that people would say like outright things. It was more of like kind of like behind my back, I guess. But my mom, my daughter, she was my mom. Yeah.
All right, let me take a feel here. Yeah. All right, rest your head back for me.
Okay.
And we want to go after some of these other little ones too, huh?
Yeah.
So this one up here. Not painful at all.
No.
Okay. These are all chip shots.
Yeah.
These are all little easy ones.
Yeah.
You can go to Dr. Pimple Popper. She can get those. Those are easy. This one is for me.
Yeah.
This is the big daddy we're gonna take care of. So I want to take a look inside. So I'm gonna put a little speculum inside your nose so I can see the extent of this. So it feels well circumscribed, and it might involve the cartilage of the nose, and obviously the skin. So our nose, or everyone's nose, is made up of skin, right, on the outside, cartilage underneath, and bone, which is the structure of the frame of the house. And then all the scaffold, everything else goes on top of that. This tumor is a tumor of the soft tissue, so it's inside the skin. But sometimes when tumors kind of put pressure on structures, or depending on what's going on underneath, they can displace or change those structures.
Right.
So I think this is all kind of a soft tissue thing.
Right.
But if I need to, I'll move around cartilage or build everything up as much as I can to give your nostril shape and support. So as a facial plastic and reconstructive surgeon, most of my time is dealt with dealing with patients who have cosmetic concerns. But a big part of my background was actually dealing with head and neck cancer and tumors of the head and neck. One part or one aspect of these tumors are tumors that are actually just non-cancerous growths. Neurofibromatosis type 1 is one condition that fits into this category. Patients who are afflicted by this condition actually have tumorous growths that can form all along their bodies. And these tumors are not cancerous, but they can cause problems because they can disfigure a patient or actually make a patient's self-esteem a little bit lower. So part of my job, and I'm excited, I get to flex that muscle, that reconstructive muscle, and help Danielle. So what I'm doing with my fingers, because I don't have a CT scan, is I'm trying to feel where it ends. And it comes all the way up. And this is all soft. So it doesn't have as much structure as the other side.
Yeah.
So there is a chance that I might want to steal a little bit of cartilage from your ear.
Okay.
To try to actually make a little bit of support.
Right.
We call that a rim graft, right? So that it doesn't want to collapse. Because right now, basically everything is just falling on the weight of the mass. So if I'm able to create a nice little arch, then it can keep things open, like a stent.
Okay.
So I might want to do that. We might want to add that to the consent. And then in terms of the width, okay. I'm excited. I can see it. I'm starting to be able to see it, right?
Okay.
Everything in plastic surgery is like a puzzle piece.
Right.
This is your unique puzzle.
Okay.
Right?
Right.
Because there's no nose that's exactly like yours.
Right.
Right?
Exactly.
So I can't open up a book and it tell me what I need to do. I kind of have to sculpt it and think through three-dimensionally, how do I put the pieces together, thinking about the anatomy. So I'm excited.
Nice.
A little bit of this is a box of chocolates.
Yeah.
You just have to you have to take a bite and see what's inside. So I'll learn more tomorrow when I open up the skin.
Okay.
Right now I have a pretty good idea about what I want to do.
Somebody was just asking a question. What is the yeah, they're kind of versus somebody else will say I wanted.
So working with my wife is awesome, but it's definitely challenging at times. So my wife for years was my sugar mama. When I was a broke med student, when I was in debt as a med student, a broke resident, and early stages of starting my practice, she was the one who was making all the big money, the big dollars. And she was doing that in the business world. And so while I was developing all my skills in medicine and learning how to be a nice fancy surgeon, she was going on business trips and consulting and helping out with all these Fortune 500 companies. And so she learned a lot during those years, and she brings that to the table now. My wife is a great executor.
I think I actually wrote the initial job descriptions. Our first hires were Maria, the practice manager, and then shortly thereafter, Seline, who at the time was front office receptionist as well as kind of everything else.
I'm not very in front of the camera very often, so it makes me a little nervous sometimes. Hi, my name's Seline, and I am
Celine's been there from the beginning, from basically setting up chairs and unboxing things in the office. She was the first person that I hired. She's an all-around workhorse. So she's the person, if I'm doing something in the office, she's the person who's assisting me with a minor surgical procedure. She's restocking in the back. She's answering phones. She's working on little projects that I'll give her.
Early days here were kind of stressful just because it was me. So I was kind of answering phones, talking to patients, scheduling appointments, as well as still doing back office and still doing surgeries and still making sure that everything was clean. And
I trained her from my living room. She was sitting on the sofa with my dog.
She was learning things that she'd never even heard of before. And it's actually been pretty exciting because most of our staff didn't necessarily know a lot about facial plastic surgery before they started, and they certainly didn't know the instruments that Dr. Truesdale uses. And so they would be making flashcards about the different things, and so they weren't saying like, oh, you mean like this forky looking thing? Like they would actually say the correct name of his instruments over time.
So we have here, thanks for helping me with these.
yes, I know I got a little bit behind on them, but it's been really, really busy.
It has been busy. It's been good. Different than when you first started, huh?
Oh yeah, 100%.
Yeah.
Way busier.
So have you been thinking any more? How's school going?
School's going good. I'm actually going to be starting my first nursing class officially in this month, actually. A dream that I have right now is to finish nursing school. I am going to school part-time during the night times to be able to finish that. But my dream is to get my actual nursing license and be able to continue to grow within the company and be able to do more and have a physical license to be able to back it up with it.
What's the class about?
It's pharmacy stuff, so more like going into medications and things like that.
Okay.
But it's like the first nursing class that I can take without like finishing all my prerequisites yet. So still trying to finish all my prerequisites, but at least like I'm kind of starting like getting there at least a little bit closer.
You're getting there. You're way closer than you were.
Yeah.
Do you remember our first conversation about what you wanted to do, like about nursing?
Yeah.
And I was like, go to
way
school?
back then.
Yeah. And you're like,
Then-
okay, I'll look.
It took a little while, it took a lot of pushing, but
I'm proud of you. That's really, really good.
You know, it's crazy, guys. We've just been in business for, like I said, almost 3 years, but we've grown so fast, and I'm so proud to be part of this. Juliana and Dr. Truesdale really have a vision, and they do not stop. It's like there's a thought, and we're running with it. It's a speed here.
So a very interesting part of Danielle's surgery is that we actually did it all under local anesthesia. This was a very in-depth surgery because there were several tumors scattered along her face that I needed to remove. Those are actually fairly easy to do under local anesthesia, but the nose posed a very interesting problem because basically it was like doing a full rhinoplasty awake. There are two aspects that I really needed to consider here. Number one was I did not want her to bleed into her airway. Whenever we do rhinoplasty, usually we have the patient asleep or at least sedated with a breathing tube in place to prevent blood from dripping down into the lungs and causing an aspiration. So in her case, I actually had to think outside the box. She could not go to the operating room, so we did this in the office. I used a special surgical hemostatic agent, which basically is like a tampon that goes in the nose and prevents the blood from dripping down. In medicine, we use this for people with nosebleeds. So I have never heard of this being used for this aspect, but what it did is it allowed any blood related to the surgery to not go down her nose, but to basically just stay where I could take care of it with suction. Now, once I had her completely numb, which is very, very interesting because it's a large area, both nerves on the outside of the skin and the inside of the skin needed to be numbed. So we had to take our time. I needed to inject the numbing medicine into the skin without causing too much distortion of the tissues so that I could accurately figure out how to contour and remove the perfect amount of skin. We were able to do that, but it became a very nuanced game of a jigsaw puzzle. How much skin to remove, how to move the ala, how to create a nice arched nostril, how to create more symmetry besides the two sides of the nose, how to open up the airway on the inside, what to do with the inside skin of the nose, any cartilage that's there. And so while I'm doing this surgery, it's like a constant discovery. Basically, it's like peeling back an onion, but the onion itself is different nooks and crannies, and it's kind of all over the place. Once I had opened up the skin, I'm able to kind of better define where the tumor is. Now, that tumor usually can form a very nice tight pocket that's well circumscribed from the other tissue. In the nose though, because it's been there for so long and put pressure on the cartilage and the other support system inside the nostril, some of that anatomy was very distorted and it was challenging. I was able to open everything up and then very meticulously put it back together. Oh, hey, Kristen.
Hi.
Come on in.
Do you have a minute to review a patient?
Yeah, let's do it.
Okay, perfect. So I have a patient here. She is going on vacation and she is looking to do buccal fat removal, liposuction under the chin. My name is Crystal and I am the newest patient care coordinator here at Dr. Truesdale's office.
So how's the PCC model been?
It's good. I think the biggest challenge has been just kind of getting used to the script.
Yeah, it's definitely a different way of kind of thinking about things because with our model, basically, when a patient calls in, you're their concierge. So you walk them from not knowing anything or knowing a lot or knowing the wrong things to explaining the process, about me, about the surgery, downtime, all of that, the costs, and then really like kind of making that sale so that by the time they get to me for the consultation, they kind of understand. And so then it's just repetition, and then you kind of walk them through the process.
So the first few months, my goal is to sell services and surgeries, of course. And then the challenges is just getting used to the way that they do things differently in this particular office. Just the scripting and just the Truesdale way.
Perfect.
Perfect.
Awesome. Well, thanks. Anything else?
No, that's
All right.
it.
I'll see you soon.
Thank you so much.
So for sure, I think with the surgery upcoming with the neurofibromatosis off my face and my nose, obviously, I will look different. So it's going to be something that I'll probably have to get used to. I know that I'll be more confident. I know that I won't be so like nervous to be around like new people, because that has been something that kind of has affected me in the past. Not so much as I got older, but more when I was younger, it has. And I think it's gonna look good, so I'm excited. Yeah.
All right, dear. So everybody in the office is already crying. You ready to see? I'm gonna let the girls come up and look and all that.
Okay.
It's pretty.
Feel great. I'm not in that much pain. It looks really good. I'm really happy. The whole process was really fast and easy. I got right in. I didn't have to wait. I got prepped and they got started. I was shocked how fast it went. I didn't think it was gonna go that quick. It was really, I'm in shock.
Cool.
Okay, thank you so much.
You're welcome. My pleasure. My pleasure.
No, I appreciate it.
Yes.
Probably, I think people at home are gonna think, wow, like she looks different. It's definitely gonna change a lot. I mean, I think I wanna be like one of those moms who's always at the school. So yeah, it's definitely gonna change a lot. I would say that it was a little bit different because, you know, like I said, sometimes going out places is like kind of a little weird sometimes, like people look and stare, but yeah, I'm really happy I'll be able to be more active with her. I would say if you're scared or down on yourself with having surgery, just do it. I know it's kind of hard to put yourself out there like that, but definitely just go ahead and do it. There's, like I said the other day, no risk, no reward, so just go ahead and do it.